ਸਵਾਗਤ ਹੈ। ਸਾਡੇ ਨਾਲ ਅੱਜ ਰੀਜਨ ਆਫ ਪੀਲ ਤੋਂ ਐਸੋਸੀਏਟ ਮੈਡੀਕਲ ਆਫੀਸਰ ਆਫ ਹੈਲਥ ਡਾਕਟਰ ਡੈਨੀਅਲਾ ਕੈਮਕਨਸ ਮੌਜੂਦ ਹੈ। ਅਸੀਂ ਦੇਖਿਆ ਪਿਛਲੇ ਕੁਝ ਸਾਲਾਂ ਤੋਂ ਅਸੀਂ ਕੋਵਿਡ ਦੇ ਉੱਤੇ ਬਹੁਤ ਜ਼ਿਆਦਾ ਫੋਕਸ ਸੀਗਾ। ਲੋਕਾਂ ਨੇ ਫਰਸਟ ਸੈਕਿੰਡ ਥਰਡ ਡੋਜ਼ ਦੀ ਵੀ ਲਾਈ ਹੈ, ਕੋਵਿਡ ਦੀ ਵੈਕਸੀਨ ਲਾਈ ਹੈ, ਲੇਕਿਨ ਅੱਜ ਦੀ ਕੰਡੀਸ਼ਨ ਦੇਖੀਏ ਤੇ ਕਾਫੀ ਲੋਕ ਜਿਹੜੇ ਹੈ ਉਹ ਸਿੱਖ ਹੋ ਰਹੇ ਹੈ, ਇਲ ਹੈ ਰੈਸਪੀਰੇਟਰੀ ਵਾਇਰਸ ਦੇ ਨਾਲ ਵੀ। ਰੀਜਨ ਆਫ ਪੀਲ ਚ ਕੀ ਹਾਲ ਹੈ ਔਰ ਕਿੱਦਾਂ ਅਸੀਂ ਸੇਫ ਰਹਿ ਸਕਦੇ ਹਾਂ ਵਿੰਟਰਸ ਚ, ਅਸੀਂ ਜਾਣਾਂਗੇ ਡਾਕਟਰ ਤੋਂ। ਡਾਕਟਰ ਕੈਮਕਨਸ, ਵੈਲਕਮ ਟੂ ਪ੍ਰਾਈਮ ਏਸ਼ੀਆ।
Thank you.
For last 2 years, our focus was mainly on COVID and getting all the 3 shots of vaccine, booster shots also. But in the today's situation, we are seeing that most of the people, they are getting ill and seriously with respiratory virus. So what is the actual situation here in region of Peel?
As you said, there are different viruses circulating right now that cause very similar symptoms such as a sore throat, a headache, a fever, and a cough, and just general feeling unwell. And 3 of those viruses are COVID-19, which we're of course all very familiar with, the flu virus, and respiratory syncytial virus, or short RSV, which predominantly affects young children. So for COVID-19, the situation in Peel right now is quite stable. And we know this from testing our wastewater, where we're seeing consistently high but stable levels. And those levels are actually higher than we would like to see. And that means that residents in Peel are still getting ill with COVID, just like they do in other parts of the province. For the flu virus, it's actually that this year it came much earlier than in other fall seasons. So we're actually seeing a spike in influenza cases right now. And the flu is making a lot of people quite sick, prompting them actually to seek emergency care or having to be admitted to hospital. And then the third of these viruses is RSV, which I mentioned predominantly affects young children, and they are also needing to seek care at the hospital or at the emergency room. And those 3 viruses have been termed the triple threat. And of course, with the cold weather arriving, like we saw today and in previous weeks, it drives people indoors, and it actually gives these viruses a better chance to be transmitted to other people. So that's why we're seeing quite a high number of people becoming ill right now.
Dr. Daniela, the RSV, because that's the talk of the town, we have seen so many cases in young children of RSV, which is a respiratory virus. Is RSV is there in the adults also?
Adults can also get RSV, but in adults, the symptoms are usually less severe. Most adults, by the time they become older, have been exposed, have had infections with RSV previously. So it's predominantly the young children where we see where symptoms are worse and who have to actually seek medical care. But RSV doesn't necessarily distinguish by age. It's just really that young kids, have the worst symptoms, caused by RSV.
Dr. Daniela, since we are dealing what is being called a triple threat, as you already mentioned what is triple threat, so how are the residents able to know what they are dealing with at home in the event they feel unwell?
Yeah, so as we talked about, the symptoms are very quite similar. So the most important thing when you feel unwell is actually to stay home and take care of yourself. And you also want to make sure that you don't go out and pass on the virus to others. Now, for COVID, most people will be familiar with the rapid antigen test, the test that you can do at home to see if you have a COVID infection. Of course, we know with new variants arriving, those rapid antigen tests don't always tell us for sure if we have a COVID infection. So if a rapid antigen test is negative, it doesn't necessarily mean you don't have COVID. So it becomes even more important that you stay at home. For influenza and RSV, we don't test routinely. So again, it's most important to watch your symptoms, try to make yourself feel better. If you're experiencing symptoms that are worrisome for you, you should definitely seek medical care. So you could, talk to your family doctor if you have one, or go to a walk-in clinic, or go to one of the cold and flu clinics that are available in all of our communities. And of course, if you or someone else that you love experiences really bad symptoms that are worrying you, for example, they have difficulty breathing, definitely please call 911 or go to an emergency department near you. There's also help at 811 24/7 in different languages available that may be able to help you understand what your symptoms are and give you advice on what your next steps should be.
Doctor, how can we stay safe this winter?
I think that's an excellent question, and I think actually the most important one. So to protect yourself, the ones that you love, and the others around you. There are different steps you can take. We call them layering, the layers of protection. And so for COVID and the flu, the most important step that you can take is to get your shots, your vaccinations. For flu, everybody who's more than 6 months of age, so babies, everybody up to babies to our seniors are eligible for the flu shot. For COVID-19, it's all the children 5 years above and adults are eligible for their primary series and also their booster doses. And the interesting thing is you can actually get both shots at the same time. So if you need a booster and you haven't gotten your flu shot, definitely, you can get them at the same time, so you don't need to make separate trips. The other things then, what are also important for consideration if you're still debating whether you want to get your shot or not, we're heading for a lot of people into the holiday season, into school holidays. Schools will be closed. People will have more social gatherings, more fun are coming more inside. So the time to get your shots is now, because it takes about 2 weeks for you to get the full effect of the protection that those flu shots and the COVID shot can offer. So if you get it now at the beginning of December, come the end of December, you'll have that full protection. But of course, there are other steps you can take as well. So as you know, the province has strongly recommended masking in indoor places. That would include, of course, public transport and schools. If you go to the mall, it's a really good idea to wear your mask. And also, everybody 2 years and up for children as they tolerate it or with supervision. Other measures you can take is practice really good hand hygiene. So wash your hands regularly. If you see those hand sanitizers being, placed at the doors of the stores, use them. And as we have heard over the last few years, many times when you cough and sneeze, please cough into your arm. Keep your surfaces clean. And by all means, if you're feeling ill, stay home and make sure you don't go to places where people may be more vulnerable. So, if you're sick, don't, for example, visit a long-term care home. Stay home until your symptoms have improved, and then you're good to go out again.
Dr. Daniela, you mentioned before the importance of boosters for COVID.
Mm-hmm.
And more specifically, what is the bivalent COVID vaccine and how is it different from the original COVID vaccine then?
Yes, so the original COVID vaccine targeted the virus that first appeared in, at the end of 2019 and 2020. The bivalent booster contains the shot against the original virus, but also targets the Omicron variant, which has been causing significant, and its subvariants have been causing significant illness, of course. So you kind of get a dual protection, which is fine-tuned to the virus that are currently circulating. That idea is very similar to what we're seeing with the flu shot every year. Every year, the flu shot is improved to make sure you're best protected against that type of virus that is circulating right now.
Dr. Daniela, are the side effects, if we talk about the side effects, are the side effects of bivalent COVID vaccine, are they different from the original vaccine or are they the same?
Types of side effects that we see from both the original and the new bivalent booster are very similar. And in the overwhelming majority, they're very, very mild. You may have some swelling or, some redness, some mild pain where you got the shot. But overall, they're very safe, and the benefits of protecting yourself and those around you with the COVID booster outweigh by far the minor side effects that some of us will experience. So, yes, absolutely, the shot is still one of the most effective ways to protect yourself from COVID-19.
What is the best time to get a booster if someone has to plan this booster? What is the best time?
So first you need to get what we call your primary series. For most people, that will be 2 shots. And then for the booster dose, it's usually 6 months after the last vaccine or after you completed the primary series. There are some people who may be eligible for an earlier booster shot. And so definitely, if you're interested about what interval is best for you, should talk to a healthcare provider. But the general guidance is about 6 months after your last booster or after you completed your primary series.
Dr. Daniela, if someone is fully vaccinated, means they got all the 3 doses of vaccine, is booster, the 4th dose, is still required?
So we now talk about not necessarily how many doses of vaccine you have received, but to see if you're up to date. And currently the definition of up to date is that your primary series and a booster dose within the last 6 months. So, if for say your last booster was maybe a year ago, or you got your first 2 doses a year ago and haven't gotten a booster since, definitely get one now and you will be considered to be up to date. And you're protecting yourself and those around you at the same time.
So, Doctor, what COVID-19 vaccine boosters options are available for children?
So, children are eligible for the Pfizer bivalent booster after, once they are 12 years and over. And for those age 18 and over, so adults, they can also get the Moderna booster.
So how can someone book the booster appointment if they have to?
Yeah, so certainly you can find the online booking options online. I will tell you the web address, but I'm hoping that you can also provide your audience with a spelled out version. It's actually peelregion.ca/COVID-19 vaccine, or through the Ontario's vaccine booking portal at ontario.ca/book-vaccine, or you can call the Provincial Vaccine Contact Center at 1-833-943-3900. 1-833-943-3900.
Dr. Daniela Camkins, thank you very much for this, all the vital information you provided. And the end, what message you want to give to the Ontarians, to the region of Peel residents?
Thank you very much. It was my pleasure. It's really the key message that everybody should take away today is we all can do our part to protect ourselves and those around us, especially the children. So please go out, get your flu shot, get your vaccine, get your COVID-19 booster, and also it's safe for children to get either vaccine. So please go ahead and contribute your part to making this also a very good holiday season.
Thank you, Dr. Daniela Camkins. Thank you. All the best. Thank you very much.
Thank you very much. It was a pleasure to be with you.
So, आज के Associate Medical Officer of Health Region of Peel तो Dr. Daniela Camkins. ਸੋ ਟ੍ਰਿਪਲ ਥ੍ਰੈਟ ਦੇ ਬਾਰੇ ਦੱਸਿਆ, ਰੈਸਪੀਰੇਟਰੀ ਵਾਇਰਸ ਜਿਹੜਾ ਬੱਚਿਆਂ 'ਚ ਬਹੁਤ ਫੈਲਿਆ ਹੋਇਆ ਓਨਟਾਰੀਓ 'ਚ, ਕੈਨੇਡਾ 'ਚ, ਉਹਦੇ ਬਾਰੇ ਦੱਸਿਆ। ਸੋ ਬੂਸਟਰ ਲੈਣਾ ਕਿੰਨਾ ਜ਼ਰੂਰੀ ਹੈ ਇਹ ਵੀ ਉਹਨਾਂ ਨੇ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ। ਸੋ ਅਪਾਇੰਟਮੈਂਟ ਕਿੱਦਾਂ ਬੁੱਕ ਕਰ ਸਕਦੇ ਹੋ ਬੂਸਟਰ ਦੀ, ਇਹ ਵੀ ਦਿੱਤੀ ਹੈ। ਸੋ ਰੀਜਨ ਆਫ ਪੀਲ ਆਪਣਾ ਪਾਰਟ ਕਰ ਰਿਹਾ ਹੈ ਕਿ ਐਜੂਕੇਟ ਕਰ ਰਿਹਾ ਕਮਿਊਨਿਟੀ ਨੂੰ ਕਿ ਬੂਸਟਰ ਦੇ ਫਾਇਦੇ ਕੀ ਹੈ, ਬੂਸਟਰ ਵੈਕਸੀਨ ਦੇ। ਉਮੀਦ ਹੈ ਪ੍ਰੋਗਰਾਮ ਅੱਛਾ ਲੱਗਾ ਹੋਵੇਗਾ। ਫੇਰ ਕਿਸੇ ਗੈਸਟ ਨਾਲ ਰੂਬਰੂ ਜਲਦ ਹੋਵਾਂਗੇ। ਦੇਖਦੇ ਰਹੋ ਪ੍ਰਾਈਮ ਏਸ਼ੀਆ, ਤੁਹਾਡਾ ਆਪਣਾ, ਤੁਹਾਡੇ ਲਈ।